Hi everyone, this is a detailed video of mine about Shigella infection. Shigella infection, Shigellosis is an intestinal infection caused by a family of bacteria known as Shigella. The main sign of Shigella infection is diarrhea, which often is bloody. Shigella is very contagious. People get infected with Shigella when they come in contact with and swallow small amounts of bacteria from the stool of a person who is infected with Shigella. For example, this can happen in a child care setting when staff members do not wash their hands well enough after changing diapers or helping toddlers with toilet training. Shigella bacteria can also be passed in infected blood or by drinking or swimming in unsafe water. Children under 5 years are most likely to get Shigella infection, but it can occur at any age. A mild case usually clears up on its own within a week. When treatment is needed, doctors generally prescribe antibiotics. Earlier, I posted a short video about Shigella infection. I hope you have seen this, and today I am going to discuss this illness in detail. Now, let me tell you the symptoms. The signs and symptoms of Shigella infection usually begin a day or two after contact with Shigella, but it may take up to a week to develop. Signs and symptoms may include diarrhea that contains blood or mucus, stomach pain or cramps, fever, nausea, or vomiting. Symptoms generally last for about 5 to 7 days. In some cases, symptoms may last longer. Some people have no symptoms after they have been infected with Shigella. However, their feces may still be contagious up to a few weeks. You should contact your doctor or seek urgent care if you or your child has bloody diarrhea or diarrhea severe enough to cause weight loss and dehydration. Also, contact your doctor if you or your child has diarrhea and a fever of 101 degree Fahrenheit, that is 38 degrees centigrade or higher. Now, let me tell you the causes. Infections occur when you accidentally swallow Shigella bacteria. This can happen when you touch your mouth. Direct person-to-person contact is the most common way the disease is spread. For example, if you do not wash your hands well after changing the diaper of a child who has Shigella infection, you may become infected yourself. Another cause could be if you eat contaminated food. Infected people who handle food can spread the bacteria to people who eat the food. Food can also become infected with Shigella bacteria if it grows in a field that contains sewage. Another mode of transmission can be if you swallow contaminated water. Water may become infected with Shigella bacteria either from sewage or from a person with Shigella infection swimming in it. Now I'll tell you the risk factor. The first risk factor is being a child. As I told you before, children under 5 years of age are most likely to get Shigella infection, but Shigella can infect people of any age. Living in group housing or participating in group activities, close contact with other people spread the bacteria from person to person. Shigella outbreaks are more common in child care centers, community wading pools, nursing homes, jails, and military barracks. Also, if you are living or traveling in areas that lack sanitation, people who live or travel in developing countries are more likely to get Shigella infection. And then another reason could be, a risk factor is being a man who has sex with men. Men who have sex with men are at a higher risk of Shigella infection because of direct or indirect oral anal contact during sexual activity. Now I'll tell you the complications. Shigella infection usually clears up without complication, but it may take weeks or months before your bowel habits return to normal. Complications may include dehydration. The constant diarrhea can cause dehydration. Signs and symptoms include lightheadedness, dizziness, lack of tears in children, sunken eyes, and dry diapers. Severe dehydration can lead to shock and death. Seizures. Some children with the Shigella infection have seizures. Seizures are more common in children who run a high fever, but can occur in children who do not have a high fever. It is not known whether the seizures are a result of the fever or the Shigella infection itself. If your child has a seizure, contact your doctor immediately. Then another complication could be rectal prolapse. In this condition, straining during bowel movements or inflammation of the large intestine may cause the mucous membrane or lining of the rectum to move out through the anus. Then a dangerous complication of hemolytic uremic syndrome can happen. This rare complication of Shigella, more commonly caused by a type of E. coli bacteria than by Shigella bacteria, can lead to a low red blood cell count, that is known as hemolytic anemia, low platelet count, that is thrombocytopenia, and acute kidney failure. Then there is another dangerous complication, that is toxic megacolon. This rare complication occurs when your colon becomes paralyzed, preventing you from having a bowel movement or passing gas. Signs and symptoms include stomach pain and swelling, fever and weakness. If you do not receive treatment for toxic megacolon, your colon may break. It may rupture, causing peritonitis, which is a life-threatening infection requiring emergency surgery. Then another complication could be reactive arthritis. Reactive arthritis develops in response to an infection. Signs and symptoms include joint pain and inflammation, usually in the ankles, knees, feet, and hips. Usually in the ankle, knees, feet, and hips. Redness, itching, and discharge in one or both eyes, that is conjunctivitis, and painful urination, that is urethritis, can also occur. And then bloodstream infection, bacteremia is another complication. Shigella infection can damage the lining of the intestine. In rare cases, Shigella bacteria can enter the bloodstream through the damaged intestinal lining and cause a bloodstream infection. Now I'll tell you some preventive measures. Well, although researchers continue to work to develop a Shigella vaccine, nothing is available yet. To prevent the spread of Shigella, wash hands with soap and water for at least 20 seconds frequently. Watch small children when they wash their hands. Throw away soiled diapers properly. Disinfect diaper changing areas after use. Do not prepare food for others if you have diarrhea. Keep children with diarrhea home from childcare, playground, or school. Avoid swallowing water from ponds, lakes, or untreated pools. Avoid sexual activity with anyone who has diarrhea or who recently recovered from diarrhea. Do not go to swimming until you have fully recovered. Okay, now I will tell you about the diagnosis of Shigella. Well, diarrhea and bloody diarrhea can result from a number of diseases. Confirming a Shigella infection involves taking a sample of your stool to be tested in a lab for the presence of Shigella bacteria or their toxins. Now I'll tell you the treatment. Shigella infection usually runs its course in 5 to 7 days. Replacing lost fluid from diarrhea may be all the treatment you need, particularly if your general health is good and your Shigella infection is mild. Now I'll tell you about some over-the-counter drugs. Well, you should talk to your doctor before taking the over-the-counter medicine intended to treat diarrhea. Diarrhea can be caused by a number of conditions, and OTC drugs may make some conditions worse. If a lab test has confirmed that you have Shigella infection, an OTC drug, over-the-counter drug containing bismuth subsalicylate that is available with the name of Kiopectate may help decrease the frequency of your stools and shorten the length of your illness. However, it is not recommended for children, pregnant women, or people who are allergic to aspirin. Also, you should avoid taking OTC anti-motility drugs such as loperamide that come with the name of Imodium, and drugs containing the combination of diphenoxylate and atropine that come with the name of Lomotil. These drugs are not recommended for Shigella infection because they can decrease your body's ability to clear the bacteria and make your condition worse. Regarding antibiotics, for severe Shigella infection, antibiotics may shorten the length of the illness. However, some Shigella bacteria have become drug resistant. Well, I am also uploading images so you can see which antibiotics are usually used for the treatment of Shigella infection. As I told you, some Shigella bacteria have become drug resistant, so your doctor may not recommend antibiotics unless your Shigella infection is severe. Antibiotics may also be necessary for infants, older adults, and people who have HIV infection, as well as in situations where there is a high risk of spreading the disease. Fluid and salt replacement. For generally healthy adults, drinking water may be enough to counteract the dehydrating effects of diarrhea. Children may benefit from an oral rehydration solution such as Pedialyte, available in drugstores. Many pharmacies carry their own brands. Children and adults who are severely dehydrated need treatment in the hospital emergency room, where they can receive salts and fluid through a vein, that is intravenously, rather than by mouth. Intravenous hydration provides the body with water and essential nutrients much more quickly than oral solutions do. Okay, this was my video about Shigella infection. I hope you like this video. If you have any question about this, please do not forget to post your question in the comment section of this video. Thanks for watching this video. See you in the next video. Bye for now.